Hello and welcome to Edikimi's YouTube channel, an editorial discussion for 5th May 2022. My name is Harsh Singh, and in this video we shall discuss an editorial from today's Indian Express which is titled "The Dead Have Been Counted." This editorial, right from the name itself, sounds like an response to an editorial that we have discussed previously a couple of weeks back. The previous editorial was "The Dead Must Count," and this editorial is titled "Dead Have Been Counted." These are very interesting kind of editorials which provide an insight from one side of the story and another side of the story. Now, just yesterday, we have had the release of the Civil Registration System report of 2020, which talks about the birth and death registrations in the country. And that's why government says that we have now in light the number of COVID deaths possibly which have happened in the year 2020. And this is a reaction to the previous editorial, which was written by a specialist from Harvard University, a professor from there. And this is been written by the editorial that we're discussing right now has been written by a member of Niti Aayog. So interesting editorial. If you like this initiative, share some love through likes, comments, and shares. We will also publish the previous editorials link in the comment section. So if you've not watched that one, please do ensure to watch it because WHO and Lancet reports have mentioned the deaths to be as many as 8 times the deaths that have been recorded by government. Government says 5 lakh deaths have happened because of COVID, and WHO, Lancet reports, and certain other reports also mentioned that the reports have been 8 times, amounting to 30 to 40 lakh deaths because of COVID in the last 2 years. Let's discuss this editorial. The website on the right that you see is the website for Civil Registration System. This is a network of registration of continuous, permanent, compulsory, independent, and universal recordings of the births and deaths that happen throughout the country. There are as many as 3 lakh offices throughout the country, and through the network of these offices one can register deaths or births through an automated process. In case people are not registering, there will be government authorities which will be doing this work, and eventually the Office of Registrar General publishes the eventual report which talks about the number of deaths and births every year. Now, because of this delay that we see, 2020 report has been published right now. It is because there is a sufficient gap given so that other people who have not registered their birth or death, they can also report here. So this is about civil registration system, an important system which can tell us about the increase or decrease in birth and death in the country. Now this is important that we register death or birth because these days bank account creation or Jan Dhan account, land registration, all of them are dependent on the births of an individual or death. For example, if one dies and the person has some bank account details or land registration in their name and it has to be passed on, the death certificate is mandatory. Now, for that same reason, we have seen 85% of the births and deaths being registered now. Earlier, people were not aware, people did not know the value of these certificates, so registrations were not happening. This is where the editorial says that now this year we have recorded in 2022 81 lakh deaths in the country, 81 lakh deaths in all. And 1 year before that, that was printed in last year itself, we had 76 lakh deaths, and and a year before that we had 69 lakh deaths. That means if we have seen excess of 7 lakh deaths last year and excess of 5 lakh deaths this particular year, what is the reason for this? Is it COVID or is it something else? See, when we see the times of 2018-19, there was no COVID. There was COVID only in the gap 19 to 20, and that too in the beginning of 20. Right, the actual COVID reporting death will be of 2021, right, the second wave. So the editorial says that this is a gradual increase in the deaths. It is because of certain reasons. For example, one, awareness about registration of deaths. This is one, just being aware and people are registering. The second is, since the population size is rising, therefore there will be more number of deaths in the country. This is another reason. And the third is possible because of COVID deaths. So because of this, they have estimated around 1.5 lakh COVID deaths in the country. These are excess deaths that we are speaking of, excess deaths, right? And also one thing, if you can remember this, there has to be a decline in the death rate also because of increasing life expectancy, because of increasing age of the people. So the excess deaths do not amount to COVID deaths only. This is what the editorial wants to say. The editorial also says, see, this is a member of Niti Aayog speaking in behalf of the government. So they say the number of COVID deaths in India have been 373 per 10 lakh population. And this is far lesser than whatever is the global average, which is 804. And if you compare with the developed nations, USA has almost 8 times the number of deaths, 8 times per 10 lakh population. UK 2,500 deaths as compared to 400 in India. And France also 2,200, Sweden 1,800, Germany, Canada. These are those countries which have got a very, very good, robust medical system and also civil registration system. Now, this is one thing that they want to say. The other thing that they say is that possibly we must pat on our back because we have kept the COVID mortality low in the country, and this is where India stands tall as a nation. Now, this is contrary to whatever WHO and Lancet has provided. The editorial itself mentions that this overinflated data is possibly because of some modeling, some assumptions that have been made in a diverse country like India is. Right now, although this is what this editorial speaks, but according to my understanding, there could be a varied perception also. That is why the Dead Must Count editorial, if you have not watched, you must watch it. I will place that in the comment section. Watch that editorial to understand both sides of the story. And after that, you can also look at this question, which states enumerate 4 reasons responsible for underestimation of COVID deaths. Now, before we conclude, have a look at this image. This is present from today's newspaper itself. CRS, the civil registration system itself, says that the people of death, the proportion of death in absence of medical attention, that has increased substantially this year. More than 10% increase in the deaths which have happened without medical attention. It is because many of the hospitals had 80% to 100% of the beds reserved for COVID patients, and people who had other kind of ailments, diseases, as simple as tuberculosis or dengue, etc. They would not be provided the medical treatment, and they died because of lack of medical attention. And the proportion of death in institutional care has declined. So people who are getting admitted to hospital, the proportion of death is declining for them. So important analysis here. Now, if you like this initiative, share some love through likes, comments, and shares. And if you have any questions and doubts, please put them in the comment section. Thank you for watching.